Hey, good afternoon, everyone. I'm Maricela Brea. I'm the Director of Workforce and Intergovernment Relations for NYC at Work, our employment initiative at the Mayor's Office for People with Disabilities. In celebration of the 75th anniversary of the National Disability Awareness Month, the Mayor's Office for People with Disabilities and the Office of Labor Relations, WorkWell NYC, welcomes you to our webinar on workplace accommodation for individuals with mental health disabilities. We're going to go over quickly an access check as well as review some of the features we'll be utilizing today. For our ASL attendees, today's interpreters are Emily Hart and Gloria Vargas with LC Interpreting Services. We presently have Gloria Vargas interpreting. We're using the side-by-side gallery view, so you can see the presenter and interpreter in one side and the PowerPoint presentation on the other side. You can adjust using the sidebar in between on your screen to make the interpreter larger if you wish. We also have closed caption available. You can select the icon with the CC symbol displayed in a box, which should appear at the bottom of your screen. Once you select that, you can choose how you want to view the caption. Our captioner this afternoon is Rebecca Costner with Total Caption. We ask that you submit all your questions in the Q&A icon. And we will either respond by typing in the text box of the Q&A, or we'll respond out loud. Please note that we will use time to answer any questions you have. And also this presentation, recording, and PowerPoint will be available to you when we conclude the presentation. So all those attending will receive. There is a chat feature. You can send chat messages to the host, panelists, and attendees. But again, we ask that you submit all your questions in the Q&A icon. Today, we'll be utilizing the poll feature. We do have a couple of poll questions, so please be attentive. We want to see what your responses to our questions are. Lastly, we will ask presenters to describe themselves and the slide that they're presenting if graphics are involved, so that our attendees who are blind or low vision are able to experience what a sighted person experiences. So I'm Maricela Brea, a Hispanic American, petite female of fair complexion with brown eyes, brown long hair. I'm wearing a pale pink blouse, don't know if you could see, and a black blazer. I'm working remotely from my home office. Now it is with great pleasure that I turn it over to Ayana Mamuno, who is the Be Well Manager for WorkWell NYC with the Office of Labor Relations. Ayana?
Good morning, good afternoon, everyone, and thank you for joining us. It is our pleasure, actually, is WorkWell's pleasure to bring this very important webinar to you. And thank you so much, everyone from the Mayor's Office of Disabilities, Mayor's Office of People with Disabilities for partnering with us on this program. And so again, my name is Ayana Mbonu, and I'm the Be Well Manager of the mental health portion of WorkWell NYC. We'll be joined today by Cleo King, Martha Jackson, and we were introduced already to Maricela Brea. They will all introduce themselves and of course give a description of themselves. And so myself, I'm an African-American woman, a brown-skinned woman with an afro, lady of a certain age. I'm wearing a blue blazer and a blue shirt. I have glasses as well. I'll hand it over to Cleo to introduce herself.
Thank you, Ayana. I'm Cleo King. I'm Deputy Commissioner and General Counsel at the New York City Mayor's Office for People with Disabilities. I am a female. I have long, light brown hair. Today, I am wearing a tan striped shirt with a tan blazer that has a MOPD pin on my lapel. And now I'll have Martha introduce herself.
Thank you, Cleo, and welcome everybody. I'm Martha Jackson. I'm the Assistant Commissioner at the Mayor's Office for People with Disabilities. My role is on employment and business development, and I'm also Director of the Workforce Initiative NYC at Work. I am a white female, medium height. My picture on the slide is with a woman with very blonde short hair, but I've changed my look over these COVID days. I have sandy brown hair, I'm wearing a purple shirt, and I'm actually wearing a pink shawl. I'm in the office today, and it's a bit chilly. I wear glasses, and I have a silver necklace and earrings on. And so I'm going to turn it back over to Ayana.
Well, thank you, everyone. So next slide, please. I'd just like to tell you a little bit about your worksite wellness program, WorkWell NYC. So our goal at WorkWell NYC is to create work sites that make it easier for our employees to live healthy, active lifestyles. We understand that health is not just the absence of disease, but it is health is physical, mental, financial, and emotional. And we know that health exists on a spectrum. We're here for you with health and well-being resources, programs, and supports to help you move more, eat well, be well, and take action to prevent disease, no matter where you are on your health journey. So I'll hand it back over to Maricela to get us started. Oh, actually, I think I'll hand it over to Cleo King.
Thank you, Ayana. So this afternoon, it's now afternoon, we thought we would first start with a little bit of background on the Americans with Disabilities Act and the New York City Human Rights Law as it applies to people with disabilities. So the definition of a person with a disability in the ADA, the Americans with Disabilities Act, which was passed in 1990, so it's 30 years old this past summer. The ADA defines a person with a disability as a person who has a physical or mental impairment that substantially limits one or more major life activities. And it also includes people who have a record of such impairment. Now, I cringed a little bit when I said the word impairment. We try not to use words that maybe reflects negative image, but that is the actual quote from the ADA. So it is a person with a physical or mental disability that substantially limits one or more major life activities. The New York City Human Rights Law has a similar definition, except that it says record of such impairment. It drops the word substantial. So actually, the New York City Human Rights Law is more protective because it doesn't have to be significant, the substantial limitation to a major life activity. And a major life activity is anything from walking, breathing, eating, working. So it covers people who have physical disabilities, people who may have disabilities seen, they could be blind, low vision, there could be a person who is deaf or hard of hearing, a person who is experiencing mental health disabilities. The definition is very broad in both the federal ADA and the New York City Human Rights Law. Next slide, please. So mental health disability, it's a term that describes a broad range of mental and emotional conditions that affect a person's mood, thinking, and behavior. Now, many of us, and probably most people at some point in their life, have a mental health concern. Perhaps someone very close to you is ill and hospitalized. Maybe during the pandemic they have contracted COVID-19 and have become hospitalized. this could cause a mental health concern. You could be very stressed out, concerned, worried for the person who is ill. But then once the person begins to recover, you become less stressed, you're not losing sleep, you're not anxious. This is a mental health concern. If the concern creates ongoing difficulties with and invades your everyday life. You can't sleep, you can't eat, you can't relax. It affects your ability to get up and go to work. It affects the way you function on a day-to-day basis, the way you function with other individuals. That then goes from a major health concern for a short period of time to someone who would identify as a person with a mental health disability. And two of the most common forms of mental health disabilities are anxiety and depression. Next slide. So here's just some statistics so we can get an idea of how many individuals may experience mental health disabilities. Again, mental health disabilities aren't always apparent. It's not like a person with a disability who maybe is a wheelchair user. When you meet that person, you realize the person has a disability and it's some kind of physical disability because they are using a wheelchair. People with mental health disabilities, it may not be obvious. And if the person doesn't disclose, you would never know they had a mental health disability. So some national statistics are on the slide here. In any given year, an estimate of 18.5% or approximately 44 million adults, and adults is defined here as 18 years or older, experience mental health illness. And 4.2% or 9.8 million of these individuals report a serious or debilitating illness. So meaning that it's to the point where they can't function, they can't interact, they can't go to work. It's very debilitating. And also, people who experience mental health disabilities, sometimes it escalates into suicide. And in the US, suicide is the 10th leading cause of death in the United States. Now, the important thing about all those numbers I just said, they're quite substantial, but these were all numbers that we found before COVID-19, the pandemic, took over our lives starting in March, these past seven or 8 months now. So these numbers have most likely increased because we know that according to the National Alliance on Mental Illness, their helpline reports that the call center has experienced a 65% increase in calls and emails since March 2020. When the pandemic started, we all started to work virtually from home, go to school remotely, becoming more socially isolated. So that's a significant increase, 65%. And on this slide, we just have a table that shows some of the mental health disability categories. As we said, depression is one of the highest, depression and anxiety. Depression is 9.5% of individuals with mental health disabilities are diagnosed with depression. 4% are diagnosed with attention deficit or hyperactivity. Bipolar is 2.6% of individuals, and schizophrenia is 1%. And we put this slide in here because we really wanted to stress that individuals with mental health disabilities, it's often you don't know that a person has a mental health disability, and mental health disability can be seen in a negative light, especially in the media and the way it's portrayed in movies. They always portray the extreme. Somebody has an intense mental health issue, they become violent or very aggressive. They just don't show it in a good light. And that is one of the issues that our office, Mayor's Office for People with Disabilities, Thrive, NYC Well, are all trying to show that individuals with mental health disabilities are just individuals with a disability, an illness that's been diagnosed by a doctor. It's often can be treated by various methods, whether it's medication, other kind of well-being exercises, meditation, yoga, de-stressors, and it's never known to coworkers, friends, even family members may not know a family member has been diagnosed with one of these mental health issues. So today we're hoping to discuss more on how to interact with people with mental health disabilities in the workplace if it comes up, a coworker, someone you manage, and how we can work with the individuals and make sure everyone has a safe and healthy work environment. Next slide, please. And we've been talking about national statistics, but data from Thrive NYC hones in on New York City statistics. So on this slide, we have New York City statistics. So 1 in 5 adult New Yorkers is likely to experience mental health disability in any given year. And again, these are post-COVID numbers. Approximately 8% of adult New Yorkers experience symptoms of depression each year. But, and at any given time, over 500,000 New Yorkers are estimated to have depression, yet only 40% report receiving care for it. And the reason that is, and we've, Thrive NYC has found data and really has information backing this up. People don't report it or don't try to receive care because they're worried about how others will view them if they do seek care for a mental health disability. And that can be very debilitating. They're afraid that maybe their coworkers, their employer, their friends, their family will start treating them differently and looking at them differently if they in fact seek help. And that, that's not good for anyone. It's not good for the person who has the mental health disability or, again, their family, their loved ones, because they, don't understand what they're going through. And so hopefully we can discuss a little bit more about how we can interact with folks and make sure we create healthy, not only work environment, but just healthy living environment altogether. Next slide, and I'll turn it over to Martha for the next few slides.
Thanks very much, Cleo. So for this portion, we just want to spend a little time talking about why is mental health important? Well, mental health and physical health are really closely connected, and mental health plays a major role in one's ability to maintain good physical health. It's essential to everyone's overall health and well-being. So much of what we do physically impacts us mentally, and it's important to pay attention to both our physical health and our mental health, which can help us achieve overall wellness and set us on a path to recovery. A healthy lifestyle, can help prevent the onset or worsening of mental health conditions like depression and anxiety that Cleo has mentioned, as well as things like heart disease, diabetes, obesity, and other chronic health problems. But it can also play a big role in helping us recover from these conditions. Next slide. So when we were looking at some of the data, and a lot of this, of course, is pre-COVID, one of the things that we wanted to do is see if we could find something that was specifically related to this current time. And we know that employers are struggling with workforce concerns over COVID-19 pandemic. We all know that. We're all struggling with that. As a matter of fact, we saw in Forbes magazine that MetLife had done a survey that 74% of workers are concerned about their mental and physical well-being, 74%. And those are the people that just admitted to it. I think perhaps we're all really struggling. And here we are in this life altered, where navigating social distancing, struggling to adapt to long-term remote work and comfort level with returning to workplace environment, then anxiety and stress are really just compounded. I mean, I'm just thinking about myself and working remotely. I don't have children that are learning from home, but when we first started all of this, you know, 3 members of my family all working in one apartment, I was using my ironing board as the ergonomic desk because we didn't have enough place to go. Stress was really, you know, really felt. And finding ways to cope with that took time, effort, energy, and a lot of listening. Next slide. And this is really important, and I want everybody to really hone in on this if you can, because this is about disclosing in the workplace. When it comes to disclosure, you decide. Individuals with mental health disabilities do not need to disclose their disability to their employers or prospective employers. They don't. But a couple of things that you do need to know, and one specifically is, if you need a reasonable accommodation, you will need to disclose that you have that disability when you ask for the reasonable accommodation. Cleo's going to talk a little bit more about that, but remember, you do not need to bring it up, but if you need an accommodation of any kind, you do have to disclose. Next slide. Maricela?
Thank you, Martha. So now we're going to do a poll question. And so I'm going to pull up the poll and I'm going to launch it now. So I'm going to ask you to please respond. Who should an individual disclose to when requesting a reasonable accommodation? A, their manager, B, human resources representative, C, equal employment opportunity, EEO officer, or D, any of the above. So I'm going to wait a few more minutes. We have close to 50% have voted so far. So let's just give a couple of minutes for people to respond. Okay, so we have 66 people. Oh, people are still responding. So far, 71% have responded, and I see the numbers going up. Okay, so just for time's sake, we're going to end the polling and we're going to share the results. Great, so we have 5% said their manager, 19% said human resources representative, 35% said equal employment opportunity officer, and 41% said any of the above. Well, the correct answer, and I'm going to just stop sharing now, is D, all of the above. And so why is that? Well, because in many cases, people may go first to their manager, or they may go directly to their human resources representative. And in some cases, the EEO officer may also be the human resources representative. So it depends on which city agency you're with. So sometimes people play more than one role. But this is all very common for people to request a reasonable accommodation from any of these folks. If they go to their manager will most likely refer them to the HR representative or their EEO officer. So as long as they're going to someone and sharing, that's what's important. So there you go, D. Okay. So reasonable accommodation. Well, reasonable accommodation is any change in the workplace or the way things are done that enables a person with a disability to enjoy equal employment opportunities. Reasonable accommodation must be provided to an employee unless it causes an undue hardship to the employer. And employers must engage with the employee to determine what the appropriate accommodation is. And this is where, you know, it's about an interactive dialogue and process. And so I'm gonna turn it over to Cleo King, who will be discussing more how that interactive process looks.
Thank you, Maricela. So the employers must engage in the cooperative dialogue process. This is part of the New York City Human Rights Law. So if an employee comes and requests an accommodation, the employer needs to explain the process to the employee. If they can come and request it verbally, they can request it in writing. Once the employee makes their request, perhaps they request working remotely 5 days a week. And the employer begins to discuss with the employee, you know, well, what is your disability? The employee would say, I have a mental health disability, and give the reason why working in the office is difficult for them due to their disability. And then as they go through the dialogue, now it may turn out that the employee, for example, when is very uncomfortable, their mental health disability, they have anxiety, and when they're in large crowds, the anxiety gets worse, they have panic attacks, they can't concentrate, therefore their work product suffers, and but if they are working from home, that doesn't happen, and they can work remotely and accomplish all of their tasks. Now, that maybe the employer at that point determines that because of the employee's job function, working remotely, it can be done very easily. We've all seen in the last few months that going from in-office to remote work has worked well. So that could easily be an accommodation. And once the employer and employee agree on the accommodation, then the employer would grant the accommodation and provide the information to them in writing. Next slide, please. Now, if the employer determines that they can't meet the employee's request, now perhaps there's certain functions that need to be done in the office, so that as they go through the interactive process and cooperative dialogue, it may turn out to be that, well, yes, the employee can be in the office part-time for their certain functions that need to be done in the office, but that when they host large meetings and the office becomes crowded, that's when the person, mental health disability, the person has an issue because of the crowded environment. So it could turn out that once they do this interactive process and cooperative dialogue, that it turns out to be, well, really what the employee is requesting and needs is that they're not in the office on Wednesday, because Wednesday is, you know, a huge intake and it becomes very crowded and there's a lot of people coming and going, and that's when the person's anxiety, they have issues with their anxiety. So again, if the person and the employer agree, then the employer would give a final written determination saying, yes, we have granted your request to work remotely, and the parameters of what that means. If they've denied their request, that also has to be in writing. And if the request is denied, there are procedures through how individual can appeal throughout their agency. So that would be something that HR or EEO would let the employee know, and the final written determination that denies the request would also tell the employee, how they can appeal that denial. So and again, if the interactive process doesn't always take place when a request is made. If a manager notices that an employee's work behavior has changed, typically to date, they've been very timely, they've met all deadlines, everything, there have never been any issues, and all of a sudden an employee starts missing deadlines, coming late to work. At that point, the manager can approach the employee and ask, I've noticed that you have missed the last 3 deadlines. Is there any issue? Would you like to discuss? And at that point, that would open it up, and perhaps the employee would again engage in an interactive process, cooperative dialogue, and may say, yes, this happened, and now, and explain that now their mental health disability has caused issues at work, and now they'll start thinking about, well, what could be done so that I can still work productively, but also have my mental health disability accommodated. So the interactive process can start at various times. So, reasonable accommodation examples, it really is, the key to reasonable accommodation is it's case by case. What's gonna work for one person with a mental health disability or with any disability isn't necessarily gonna work for another person with that same disability. It's very case-by-case, individual-based. So flexible schedules may work for people with disabilities. Somebody who maybe their mental health disability, they're intimidated by large crowds, so taking the train at rush hour doesn't really work for them. So maybe if they could start at a later time or have a flexible schedule that could accommodate their disability. Another example would be quiet workspace, maybe noise canceling headphones. Perhaps relocating them to another space in the office, a corner cubicle as opposed to a cubicle that's right next to the path of travel from the door to the bathroom, working remotely, attending meetings remotely, perhaps frequent reminders when tasks or due dates are coming up, so that the person knows ahead of time and can plan accordingly. Now, reasonable accommodation may not just be for their day-to-day work. For example, a person may need reasonable accommodation to attend a meeting, to attend a training. An example that we had a year or so ago was an individual who has a vision disability, who uses a service dog, went to a training. She came with her service dog. Someone else at the training was either allergic to service dogs or had an intense fear of dogs, and the 2 people in one training room just wasn't going to work. So at that point, reasonable accommodation is you have to talk with both of the individuals. If the individual who needs the service dog is there because of their disability, they did not have to give notice they were bringing a service animal. It's already been granted that they can have the service animal at work. You don't need to give notice that you're bringing them to a training or to a meeting. Now, the other person didn't realize that there would be an animal at the training and say they're highly allergic and it can cause asthma and difficulty breathing. So that is their disability. The level of allergy raises to the level of being a person with a disability. At that point, you have to decide how to accommodate both. Now, maybe just separating them in a large meeting hall is enough. Maybe it is, well, would one person be more comfortable if they went into another room and joined the meeting virtually? So you have to work with both to try to figure out how to accommodate both. It can't be you accommodate one and not the other. So it can become a little bit of a juggling act. And we keep talking about reasonable accommodations. Reasonable accommodations mean that the accommodation is being made because of a person's disability, and it's not going to change the essential job functions of that person. If a person's essential job function can't be done even with a reasonable accommodation, then they may not be able to, that job may not be appropriate for them. And now a lot of accommodations have come up lately, and this isn't for people with disabilities who are requesting a reasonable accommodation. This is for workers who need an accommodation based on circumstance. They're not a person with a disability, but they need an accommodation because perhaps they are a caregiver for someone who is very susceptible to getting COVID-19. And if the person has to go into the office or go into traveling back and forth where they're being exposed to numerous individuals, this could cause a problem when they come home for the person that they're a caregiver for, so that they need an accommodation based on their circumstance. They want to be able to work remotely so they don't have to travel and be exposed to COVID-19 and therefore bring it back to the person they're caring for. So that is an example of an accommodation based on circumstance, and it's very different than a reasonable accommodation based on disability, which is you must follow the ADA and the city human rights requirements when you are looking at what the reasonable accommodation request is and what can and cannot be granted based on reasonableness and the individual's ability to do their job. Next slide. And I will turn it back over to Martha now. Thank you.
Thank you, Cleo. So what is a healthy work environment? Well, we're all responsible for a healthy work environment. That's not the responsibility of a manager or any one person, but we really are all responsible for creating a healthy work environment. And a healthy work environment responds effectively when a mental health disability arises. If an employee's behavior or performance changes, speak with the employee. The only way that we're going to be able to break the stigma and bust these myths about mental illness, mental health disabilities, is to be able to talk about it and be honest and be civil. If an employee has received a reasonable accommodation, also ask if an additional accommodation is needed. Now, sometimes a person will get an accommodation when they start a job and things are going really well. And then something might happen. There might be another medical condition that arises. There might be a change in medication. There might be, a chair that's needed to be able to accommodate a person based on an additional disability. Having those, Cleo spoke at great length about this, this open dialogue, this interactive conversation. And that's what's so different about reasonable accommodations now. Having these conversations are so important, and not just important for the person that is experiencing the disability, but also for everybody in their environment. I mean, if this time has taught me anything, it's how crucial it is that we really need to check in, and not just check in on staff, but check in on leadership and make sure that we are really listening to each other. Next slide, please. So don't assume that an individual with mental health disabilities, don't assume that they pose a threat, as these notions are really unfounded and they're based on misinformation, and as was mentioned earlier about the media. You saw the stat on schizophrenia, it is 1% of the population. If an issue arises, address it in a fair and equal manner based on the facts and evidence. Again, the opportunity to engage in conversation, to be able to be open and honest and civil with each other. These are the things that will change and will help us break the stigma of mental health, illness, and disability in the workplace. Next slide. Maricela, back to you.
Thank you, Martha. So we're going to do another poll question. What is a healthy environment? A, being flexible. B, providing access. Hold on, I'm going to launch this in a minute. B, providing equal access for all employees. C, empowering employees. D, fostering open communication. E, all of the above. So if you can please place your responses. Well, so far this is quick. We have more than 50% of the votes in, so we'll just give it another minute. Okay, we're gonna end our polling. We have close to 70%, and the majority, 98%, said all of the above. 1% said empowering employees, and 1% said fostering open communication. So you are correct. It is all of the above. We want to make sure, you know, as Martha previously mentioned, that a great work environment really is up to all of us. And we all have to, you know, be flexible. And we want to make sure that everyone has equal access. And we can all empower each other. So it is about fostering that open communication, empowering each other, and everybody working together to make the workplace a healthy work environment. This is so, so important. So I'm now gonna turn it over to Martha.
So if you are witnessing any bullying or harassment, please do not ignore it. Address it, but in a manner that you feel safe. And that can include reporting it to a manager or supervisor, human resources, or your EEO officer. Again, don't let any bullying or harassment of a person with a disability go unchecked. As long as you are in a safe position, you do need to address it. And there are a lot of resources that we're providing, including employee assistance programs and resources group. A lot of that is actually part of this PowerPoint, which you will be receiving. But there is a very unique website that we're suggesting. It's www.insperity.com/blog/workplace-bullying. It's really worth taking a look at. Again, empowering yourself to be able to empower each other. That's really what a healthy work environment is all about. I think I go back to Ayana now.
So thank you everyone. That was really great information. And so we will have a few moments to answer some of your questions. So either Cleo or Martha, you can jump in and answer the question if you like. Is there any work being done to normalize sick days also being used for mental health days? So either Cleo or Martha, do you know of any opportunities for people to use their sick days as a mental health day? Maricela?
I do not know of any work being done. I mean, if you are, it depends on what you mean by mental health day. I mean, if you have a mental health disability and you are having an issue, your medication is making you tired, or you are, whatever your anxiety is, something happened in your, your anxiety is to the point where you can't, leave the house, then that would be, you are a person with a disability and you are sick, and that would be a sick day. So I think it depends on the circumstances, but just like allowing people to have, quote unquote mental health days, because they need to relax. I don't know of anything, citywide policies that over at DCAS are doing. Martha or Maricela, do you know of anything else?
No, I'm not aware. But as you said, Cleo, if you're not feeling well and you know that, you need to take the day off, then, and you have your sick days, yes, I would encourage you to use them. If you're not feeling well, you should definitely use your sick day.
So I was just going to, it's Martha, and I was just going to add, you know yourself. So if you're not feeling well, don't go to work. And that's another part of being able to empower yourself to make sure that you are healthy and you go to a healthy work environment when you're in a good and healthy state. So know yourself and make a decision based on that.
Well, thank you. I'm hopeful that that information will guide the person who asked the question. And do we have another question? Will I be ostracized further if I let my director or supervisor know about my mental health? So I assume that question is asking, I guess they feel as though they are already ostracized. And so, Cleo, would you like to take that?
Yeah, I mean, if a person reveals they have a mental health disability because they're asking for an accommodation, there can't be any kind of retaliation. So if they're being treated unfairly in a discriminatory manner, then, that would be a violation of both the ADA and the city human rights law. So for example, if a person requests an accommodation and it's been granted, but now the manager is harassing or treating them unfairly and differently than other employees because they have that accommodation or made that request, that's retaliation, and that also is covered by both laws, and they would have a cause of action.
Thank you. We did have one question. How can a manager approach an employee if they suspect that there's a mental health disability?
I think it has to be based on their work. So if they've seen their work product, go down, they're not as timely, they've missed deadlines, they can ask them, is there something wrong? What's going on? But it would have to come from a standpoint of their work. So, I've noticed that you come in late every morning, you didn't used to, this has to you're opening the cooperative dialogue so that the person, if they do have a disability, can say, well, yes, I do, and make them feel comfortable to reveal it, to ask for the accommodation. But it has to be based on fact. It can't just be based on, somebody's impression, that false impression. It needs to be based in fact, as Martha had talked about. Martha or Maricela, anything to add?
No, I think you covered it.
Great. This is really great information. We have a lot of questions. We'll try to get to as many as possible. We have another one. What happens if the agency reviews your reasonable accommodation request, but simply responds that it was denied, the request, that the request was denied, but no follow-up suggestions, no opportunity to appeal or given information to appeal? How does someone, try to fight a denial of a reasonable request?
If a reasonable accommodation request is denied, there should be an appeal process. DCAS has issued, guidelines on how that process is supposed to work. So I would say, if your supervisor is the one that denied it, try to go to EEO or HR. If they're the ones that denied it with no way to appeal, try to go up the chain. Otherwise, I would recommend people could either reach out to our New York City at Work program. They may be able to help them, give some guidance, but really, I think they should reach out to City Commission on Human Rights, just maybe, not necessarily to file a complaint, but to find out what their rights are under the law and how to proceed if they, believe they were denied inappropriately.
Alrighty, so we're going to take one last question. We have one here. It says, is there accommodation for people with sleep apnea or brain tumors that make you tired? I'm not sure that's a mental health reasonable accommodation. Would you like to share?
Well, I mean, if you have a disability, so if you're sleep apnea or you have a condition where you have tumors, then if you're a person with a disability, you can make a request. Now, the employer can ask for medical documentation that says this person is a person who has a disability and needs accommodation. So again, it's very case-by-case basis. So I would say that you should ask for an accommodation. And at that point, you'll start the process if they need a doctor's letter. And again, the letter doesn't have to go into nitty-gritty details on the disability and how it affects you. It would just be that the person has X condition, and because of that condition, they can't, they need more sleep. So maybe you could, instead of showing up at work, or reporting to work at 8:30, you could report at 9, and that extra half hour is enough. Again, it's very case by case basis, and you should make the request and start the dialogue.
Well, thank you for all of that helpful information. And I know that at the end of the presentation, you all will supply your contact information. So if anyone has additional questions, they can contact you directly. So let's move, we're just gonna move on in the interest of time. We only have 4 minutes left. Yeah. So everyone, these slides absolutely will be provided to you after this is over. Perhaps, what's today? Today's Wednesday, perhaps Thursday or Friday, you'll receive an email with the links to review these slides as well. So I'd just like to tell you a little bit about our Let's Talk campaign, because it's very telling right now, everything that we've just learned in this webinar. And this is a great campaign that our office is promoting. And so the Let's Talk campaign, our mission is to eliminate mental health stigma in the City of New York workforce by creating supportive workplaces and building resilience in employees. And this is really what we're talking about, just being supportive and encouraging to one another. Mental health is at the forefront of everyone's mind during the pandemic, and we want to encourage people to be very supportive and supportive of one another. And so the Let's Talk aims to do this by promoting education, awareness, and knowledge about mental health at work. And if you are someone who would like to pledge your support, it means that you're recognizing mental health is an important component of your overall health and well-being. You're making mental health a priority in the workplace, and you're reaching out to support your colleagues. We've just indicated the link in the chat section. So go ahead and click on the link so that you can pledge your support. Throughout the year, you will receive more information about different Let's Talk initiatives and resources to help you continue your work being a champion for mental health. Next slide, please. And so we, as resources for city employees, we have a healthy benefits program. And if you have any questions about your mental health benefits for your specific health insurance program, you can go ahead and take this information down and email them and ask any questions that you might have. Next slide. And of course, as city employees, we can take advantage of New York City Employee Assistance Program. It's a really wonderful service. They are offering office hours now, or virtual office hours now, from 9 a.m. to 9 p.m. So they're offering extended hours, offering more support to us during this time. And so if you have any questions or need any kind of support, not sure where to go for any kind of assistance, and actually if they can't help you, they will point you in the right direction. So I say, if you have any kinds of questions around mental health or supports, it's for yourself and for your dependents. So feel free to give them a call at the number that you see on your screen. And resources for employees, Be Well, that's who we are. We provide educational resources, a wellness program for city employees to help them manage their stress and develop resilience. We are here for you for any kind of mental health supports that you might need. And again, if we can't offer the services to you directly, we will point you in the right direction. So please give us a call. And mental health resources that are available to everyone in New York City is New York City Well. They have free 24/7 confidential counseling services. You can call them or you can even text. And they offer services in different languages and interpretation services as well. And they have a wonderful website with different links to apps that may be helpful to you as well. Next slide.
Martha was covering this slide.
Okay, great. I'm gonna take, Martha, you can hand this over.
Sure, and just before I do that, I just want to let everybody know there's some really powerful questions in the Q&A and in the chat. And so we want to make sure that we're able to answer all of them. So we will be able to do that and get it out to you with the PowerPoint, if you just give us a little bit more time to do that. We just don't want these questions to go unanswered, if that's all right. And so mental health resources, the Mayor's Office for Thrive, mental health support New Yorkers can access while staying home. It's very local. The COVID Care Network for essential workers and their families, Connect to support. Queens Long Island Community Services, psychotherapy by telephone and video conferencing. Email qlicscounseling@gmail.com or call 516-574-4318 or 718-461-6393, local. Richmond University Medical Center Crisis Hotline, and Staten Island 718-818-5766, also local resources. Next slide. And the New York State Office of Mental Health Emotional Support Line, this is 1-844-863-9314. And for the front lines, free crisis counseling and text line 24/7 for frontline workers and their families. And SAMHSA, Disaster Distress Hotline, that's SAMHSA HSA Disaster Distress Hotline 1-800-985-5990. That's 24/7, and that is national.
Thank you.
Oh, go ahead, Marcella.
Thank you, Martha. So we also have the Job Accommodation Network that goes by the acronym JAN, askjan.org. This is one of my favorite resources. They provide expert and confidential guidance on workplace accommodations, not only for employers, but for employees and other professionals. And there's also the National Alliance on Mental Health Illness, NIME, and their helpline is 800-950-6264, Monday through Friday, 10 a.m. and 6 p.m. They're national. And so the calls, again, in the helpline are confidential and answered by trained family members and people living with mental health illness. So if you're if you're connecting with someone who understands and can assist you with navigating the mental health system. So I'm going to turn it over to Cleo to summarize.
Since we're running out of time, I think I just got a message to skip the summary slide, but I just wanted to say real quick, this slide just highlights basically what we've done in the last hour, and as you will all receive the PowerPoint presentation and we'll follow up with the questions, I think we can go to the next slide and close out the program. Thank you very much, everyone, for attending.
Sure, I'd like to thank everyone for attending. Thank you so much, everyone on the call, ladies from Mayor's Office of Disabilities, People with Disabilities. We thank you so very much for partnering with us on this initiative. I think it was really great information that you provided, and I'm sure that everyone on the call actually appreciated learning more about reasonable accommodations and mental health illnesses. And so I just wanted to give us this last thank you, and I put in the
Yana, you're on mute.
We have an event coming up November 6th at 2 p.m. It's New York City Matters on Race and Equality, and it's presented by the City Commission on Human Rights, and they're going to talk about the New York City's position on racial equity through policy changes and community outreach. And then we just wanted to make sure that everyone had an opportunity to register for that. It's a great next webinar and discussion that I think is very telling and very appropriate right now. So thank you again, everyone, and enjoy the rest of your afternoon.
Thank you.
Thank you.
Thank you.